She'll be presenting on ocular trauma and counterinsurgency and proxy war environment. Epidemiological study 2008 to 2023. Yeah, please come.
No, ma'am. Meet Shruti, Dr. Shruti.
Yeah, you can continue, please.
Yes, ma'am. Okay. Good morning, everyone. I'll be presenting on ocular trauma in counterinsurgency and proxy war environment. It's an epidemiological study from 2008 to 2023. It's about 16 years of data. So, military personnel across the globe are highly susceptible to either ocular injuries, and then there's a significant cause of morbidity associated with other severe injuries, even mortality as well. So these injuries can be because of routine military exercises, the road traffic accidents, assaults, or even sports and recreational activities. The high velocity projectile with tiny glasses and fragments cause injuries to the face of soldiers in intense explosions. So the trend of eye injuries in combat from when we consider from Indo-Pak war, when it was hand-to-hand combat or slightly not a advanced weaponry, it was only 3%, and it kept on increasing to 4.8 in Indo-Pak war 1971. The Sri Lanka peacekeeping war was 1987 to 89, it was 10.5. In Iraq-Afghanistan conflict, it increased to 15.8. So this is the data. So the objective of this study was to analyze the epidemiology of hospitalized ocular injuries occurring in the counterinsurgency and proxy environment in the forward areas of northern India over a period of 16 years. It was a retrospective observational study of medical records, which was performed of 948 patients with ocular injuries, primarily treated at a zonal hospital of Indian Army between January 2008 to December 2023. So the factors which were considered in, as mentioned in the previous presentation also, the factors which considered in the management of patient is the casualty transportation, how early the patient reaches you, and the widely variable evacuation time, whether they're in a place where they can reach you immediately, or despite having the severity of injury based on the priority key, whether it's a red injury, maybe priority 1, 2, 3, we grade it and then decide. The next is medical equipment limitation at the peripheral setup. So this is eye trauma which we received at our center over a period of 16 years from 2008 to 2023. So when you see this, the incidence of open globe injury has decreased. The red are closed globe injury. The incidence of closed globe injury has been increasing. The based on the mechanism of injury, the blunt trauma, the splinters, IEDs, and firing, these were the causes of closed globe injuries. And in open globe injuries, firing, barbed wire, the most common thing, and blast and splinters, and blunt traumas, and stone pelting. So these are, how do we prevent, is we give the soldiers protective goggles to prevent eye injuries. That's one way we can, even though the face, the size of such a small splinter falling somewhere over the body will not cause a severe injury, but it goes to the eye, it goes all the way back to the posterior segment. So the take-home message here is the combat-related injuries are on the rise because of advanced machinery, weaponry, and preventable. And these are injuries which can be prevented, and military combat eye protection devices can reduce the incidence of eye injury. These are my references. Thank you. Any questions? You can ask.
So this data was like from 2008 to 2023?
Yes, ma'am. Yes, ma'am, 2023.
The long period.
Yes, ma'am.
So do we have any subset analysis also, any change in pattern in the injuries between,
Yes, ma'am.
let's
Yes,
say 2008 to 15, or you know?
Yes, ma'am. The things with the present data that I'll be publishing is the injuries of open globe incidence is decreased, and the closed globe injuries increased, and especially from 2018 and afterwards, if you can see, the incidence of the recreational activity and exercise activity is increased than compared to the stone pelting and other the active combat injuries has decreased in the last 4 years.
Okay, one question.
Yes, ma'am.
How do you, like, when you operate some such patient, how do you post-operatively find out whether there is any left foreign body or not?
Ma'am, we have set up, ma'am, a CT machine is there.
So you go for a post-operative CT?
Yes, ma'am. We do consider. Yes, ma'am. There are, in that the case which I presented earlier, in the previous case, Despite foreign body removal, when I referred him to VR surgeon, he got the repeat NCCT done to just to see if there is any remaining foreign body. So we do take up for repeat CT if required.
In all types of foreign bodies?
Ma'am, all splinters, mostly from gunshot or UVGL, blast, they are the cases. Ma'am. Thank you.
Thank you very much. So we come to the end of this session.